Suicide is a tragic and complex issue that impacts individuals, families, and communities across the world. It is the act of intentionally ending one's life, often as a result of overwhelming emotional pain, feelings of hopelessness, or mental health conditions like depression, anxiety, and trauma. While many people experience periods of sadness or despair, suicide occurs when someone feels that their suffering has become unbearable and that there are no other options for relief. Understanding the factors contributing to suicide and promoting prevention efforts is essential in addressing this public health crisis. Causes and risk factors. There are multiple risk factors for suicide, and it's rarely caused by a single event. Mental health disorders, especially depression and anxiety, are among the most significant contributors. Individuals suffering from conditions like bipolar disorder, schizophrenia, and borderline personality disorder also face an increased risk. However, not everyone with a mental health diagnosis attempts suicide, highlighting that other factors also play a role. Prevention and support life circumstances such as financial problems, unemployment, relationship issues, or the death of a loved one can exacerbate feelings of hopelessness. Childhood trauma, including abuse and neglect, has been linked to a higher likelihood of suicidal thoughts and behavior later in life. Substance abuse is another significant factor, as drugs and alcohol can impair judgment and increase impulsive behaviors. There are often warning signs that someone may be considering suicide. These can include verbal cues like talking about wanting to die, feeling like a burden, or expressing hopelessness. Behavioral changes, such as withdrawing from friends and family, giving away possessions, or drastic mood swings, should also be taken seriously. Even subtle changes, such as a person seeming unusually calm or cheerful after a period of deep sadness, may indicate they have made a decision to end their life. Recognizing these signs and intervening early can be crucial in preventing suicide. Asking someone directly if they are thinking about suicide does not increase their risk but can open the door to potentially life-saving conversations. Prevention and support suicide is preventable, and early intervention is key. Encouraging individuals to seek help through therapy, counseling, and support groups can make a significant difference. Creating a strong support network and maintaining open communication is also important in reducing isolation, a common factor in suicide. On a broader level, promoting mental health awareness, reducing the stigma around seeking help, and increasing access to mental health care are essential steps toward preventing suicide. Community-based programs, crisis hotlines, and public education campaigns all play vital roles in addressing this issue. Ultimately, understanding that suicide is a result of complex, multifaceted issues can foster compassion, helping us support those in need and prevent more lives from being lost to this preventable tragedy. Please like, subscribe, and share this message.